afternoon, folks. This afternoon's topic A is navigating end of life care conversations with patients and families. So we'll go through that this afternoon for a discussion. Here we go. Here is a clear, grounded explanation of the text based entirely on the surrounding page content from the article you're viewing. What the article really is saying: navigating end of life conversations with patients and families is a practical guide for clinicians on how to approach one of the most emotionally charged responsibilities in healthcare. Talking with patients and families about dying, goals of care, and what matters most at the end of life. The surrounding page content frames these conversations not as administrative tasks, but as core components of high quality human care. Core message: the article emphasizes that clinicians play a central role in easing fear, reducing suffering, and helping families feel supported during the dying process. Even though these conversations can feel uncomfortable, they are essential to aligning care with a patient's values. Key themes from the page: clinicians are anchors during dying and grief. The article underscores that clinicians can reduce fear, minimize pain and suffering, support both patients and families as they move through the dying and grief process. This positions communication as a therapeutic act, not just an exchange of information. End of life conversations are uncomfortable but necessary. The text acknowledges the emotional difficulty of these discussions, but frames them as crucial to high quality care. Avoiding them leaves patients vulnerable to care that doesn't match their values. Three priorities guide every conversation. The article lays out a simple clinician-centered framework build trust, understand the patient's values and preferences, align the treatment plan with those values. Four, preparation matters even when time is short. When possible, clinicians should give patients time to gather the family members they want present, ask next of kin who should be included if the patient can't communicate, choose a private, quiet, comfortable setting, silence devices, and ensure everyone has a seat. Check in with their own emotional state and steady themselves before beginning. This reflects a trauma-informed, dignity-preserving approach. Why this matters. The surrounding content makes it clear that end-of-life conversations are not simply about medical decisions. They're about honoring identity, values, and relationships at one of the most vulnerable moments in a person's life. The article encourages clinicians to approach these conversations with mindfulness, emotional steadiness, respect for the family dynamics, a, a commitment to aligning care with what matters most. Okay, the next part of this, guys, is what the text means in context. Essential palliative care at the end of life, comfort and dignity skills for professionals is the headline for a blog article promoting an advanced certificate in palliative care. The surrounding page content frames this not as a geriatric training, but as a comprehensive practice oriented program designed to help healthcare professionals deliver truly humane, comfort focused care at the end of life. The text signals that the course is about building core competencies that allow clinicians to support dying patients with dignity, skill, and emotional steadiness. What the page emphasizes: palliative care is transformative. The article opens by positioning palliative care as one of the most impactful areas of healthcare. Precisely because it centers comfort, dignity, and quality of life for people nearing death. The certificate is presented as a way to deepen expertise in this meaningful work. Understanding patient needs is the foundation. The course begins with a deep dive into the physical, emotional, and spiritual needs of patients at the end of life. The page stresses a holistic approach, ensuring that clinicians learn to see the whole person, not just their symptoms. This includes recognizing distress, supporting emotional and spiritual concerns, applying learning through case studies and real world scenarios, learning from experts. A major selling point is that the instructors are industry leaders in palliative care. Their experience is framed as essential for helping learners build confidence and competence in complex end-of-life situations. Communication is core. Communication is a skill is a core skill. The page highlights that navigating difficult conversations with patients and families is central to palliative care. The course teaches clinicians how to communicate with empathy and clarity. Emotional steadiness. This aligns with the broader theme of preserving dignity and reducing fear. Symptom management and pain control. The article emphasizes that the certificate strengthens skills in pain management, symptom control, best practices for comfort care. These are described as essential competencies for any palliative care professional. 6. Versatility across care settings. The page notes that palliative care skills are needed in hospitals, hospices, community health centers. The positions the certificate as a career expanding credential. Seven, making a meaningful impact. The article closes by framing the course as a path toward profound human impact, helping patients and families navigate the end of life with compassion, respect, and dignity. In short, the text signals that essential palliative care is about mastering the comfort-focused, dignity-preserving skills that define excellent end of life care. The surrounding page content positions the certificate as holistic, practical, expert led, emotionally grounded, career advancing. It's not just a course, it's framed as a professional transformation that equips clinicians to make a meaningful difference at the most vulnerable stage of life. Okay, guys, I'll be back on with B shortly. Give me a bit for a little break, and I'll be back on with you for B. For now, Gator Wellness. Take care, folks.